Hi, I'm Teresa. I'm the Director of Utilization Review at Sierra Tucson. I'm an independently licensed clinician, and I have worked in various levels in the hospital setting, as well as I was a behavioral health reviewer with an insurance company assessing criteria for potential authorizations. The purpose of this video is that I know insurance can be super confusing, and I wanted to make sure that everybody understands what happens behind the scenes while your loved one is in our care, and to show how we advocate while your loved one is here and the different steps that we take throughout the process. I'm going to start with the criteria. Even though you may have the benefit with your insurance, it still needs to meet a criteria. So what is that criteria? For each level of care, there's a specific criteria that needs to be met for care to be authorized. The criteria can include the degree of functioning. Are they able to go to work? Are they able to do household chores? Are they grooming themselves? Are they socializing? Are they isolating? Are they taking their medication? What might the vitals be? This consists of nursing notes, provider note, the intake assessment, nursing vitals that they keep. So all this information gets compiled, and then that's what we use to advocate for a stay at Sierra Tucson. After we receive an authorization, the next thing that we do is every so many days, we're required to do a continued stay concurrent review. And what this is, it's the same information except that it's updated information. So the insurance company wants to know if they're doing better or worse or staying the same since the last review that we did. This can either take place via phone, where it's a live conversation. It can take place via fax, where we send all the clinical documentation I talked about to the insurance company. Sometimes they turn around and they send us their determination right away. Sometimes they don't send it back for quite a few days, which can be a delay in finding out if additional time has been authorized. If for any reason your loved one is not meeting the criteria, it's not necessarily something to get upset about or be concerned about. They are here to get better. So part of the reason they may not be meeting criteria is that they are getting better. So that's actually a good thing. But what we do as part of a courtesy is that we would do a peer-to-peer. And what this is that our provider will talk to the insurance provider, and they will give maybe additional information from the nurses, maybe something that they recently saw, anything that they can possibly give to turn over that decision of this denial and try to get a continued stay. If for some reason it's a continued denial, you would be notified from the continuing care team of that denial. You'd likely be asked if private pay is an option, if the denial stands for a continued stay, discuss maybe about discharge plans or next steps. Our continuing care team, they would meet with your loved one from the beginning. We meet with our patients from the beginning, whether they stay here the entire time or no matter how long they stay, just so that we have next steps in order, so that when they do depart from Sierra Tucson, we have support to give for the next steps once they leave here. We also have something called an expedited appeal. That is not a courtesy review. That would be an additional review that if private pay is an option, we would need to establish private pay before the expedited appeal would be conducted. And again, our doctor would talk to the insurance provider and try to advocate and overturn the decision. All the decisions are made by your insurance company. They determine whether they're going to auth more days or if they're going to deny a continued stay. If you could call your insurance company and advocate for your loved one, that is also a big help. I have seen many times where they overturn the decision due to communication from the family member or the financial responsible party. It's a tremendous help. Many times we'll get a call that they've changed their decision. And just so you know, we're always here if you have questions with your loved one's treatment team. Our teams at Sierra Tucson will advocate and support your loved one every step of the way while they're in our care. Thank you.